Sorry we're late. I had a little trouble getting Rhett here since he wasn't feeling so well. Were you?
You said there was blood in his urine?
Yes, I did. Oh, yes, I did.
Yeah, that's alarming on so many levels.
You can help with that, right?
Oh, we can help your dog for sure. Anything else? Well, I'm more than ready if you are, Doctor.
Rhett loves to watch old movies. Why, he barks at all the musical numbers. I don't suppose so. He seems to be straining a bit when he tries to use the little boy's room. There's been some red in his urine. Well, not something I like to talk about, but what can you do?
He's not happy. Did you feel that?
I wish I could take you home to help a Rhett all the time.
Sounds anxious. I hope you know what to do next. I'm going to take a guess and say that was a problem. We're already on our way to fixing that.
I just bought a lovely little dog bed for Rhett. Why, it's just the cutest.
I'm not surprised. At least we won't have to worry about dehydration. Infection is the last thing we need. Well, only one option left. You heard the doctor. Rhett should be fine.
And he wants to give you a kiss for it. Isn't he beautiful? Isn't he? Go ahead. You know you want to.
Yes, you are. Thank you for bringing him in.
Rhett was battling a case of bladder stones with urethral obstruction. In any other breed, uric acid, a urinary waste product, converts into allantoin, which dissolves relatively easily. A Dalmatian, however, lacks the enzyme in charge of this process, so the uric acid can form into hard crystals. Male dogs are especially susceptible, and obstructions due to these crystals can become life-threatening. With a diet low in protein and regular vet checkups, Rhett will get the upper hand on this problem. You diagnosed this patient accurately. You didn't waste your time with irrelevant questions. You conducted your treatment quite well.
He ate everything. Everything!
Ma'am, you need to calm down.
I'll be calm when there's something to be calm about. Are you going to do something about it?
Of course we will. And since you already told us part of the problem, there's no reason the doctor can't get started now. He's anxious to get started. Blue gums get my attention. I wouldn't be comfortable either. This dog's experiencing a lot of symptoms. Sticky gums, slow cab tests, we know what that means. Stomach feels tight. I can hardly hear anything. Sounds like a drum. Say goodbye to all those shock symptoms. Kind of irregular, don't you think? That's low by any standard. At this point, I'm not surprised. We have to get his heart beating normally. I hope you know what that means. Something is stopping the tube. First step done. Second step done. As bad as it smells, that's as good as Astro will feel. We like to be thorough.
Wish it were abnormal for this dog to want to eat us out of house and home. Oh, come on. You can see his stomach is too big, right? His stomach is way too big.
An animal could do worse than to have a dog like you.
Even I thought I was overreacting before, but Astro really could have died?
Not when you brought him in right away. I'll give that to you. You got a handle on yourself now?
As long as the doctor's got a handle on Astro.
You'd think the food itself causes bloat, but actually it's the air trapped in the stomach. After dealing with any shock and restoring the circulatory system, releasing the air in the stomach will dissipate this condition. That said, you might want to follow up with exploratory surgery to make sure everything is all right. The risk of death from this condition increases if any complications are present. I agree on this diagnosis. You probed the details of this case quite well. You followed procedure without a hitch.
I try to keep everything healthy. Mind, body, spirit. I couldn't let Athena live the opposite.
She seems a little quiet.
She refuses to eat. She's angry at me for not donating more to the environment.
I'm pretty sure that's not the problem.
You don't know her. She is wise beyond her form.
Why don't we see what wisdom the doctor can share? Ready, doctor?
My rabbits possess both inner and outer beauty.
Oh, look at Patty.
She's been vomiting for a couple days.
Oh my goodness. How many days?
Look, I don't have time for a lecture. I have a lot of stuff I need to do. She ate some flowers, and I thought she would just, pass it through her system.
But she didn't.
Yeah, okay, you got me. Is there anything you can do?
Of course there is. The doctor will make Patty first priority.
Patty scratches sometimes, but it doesn't hurt.
Not especially.
She's been sick ever since she got into the lilies I just bought. Can't think of anything.
More drool than normal.
I'd be too stressed to do as good a job.
Despite the drool, her gums are dry.
Now, how do you find time to learn to do your job so well?
Something's making her uncomfortable.
Well, I thought I had it all figured out.
What could be causing that? Just what I was afraid of. Hopefully we got her in time.
I bought some lilies for my mother.
I think she's going to be fine.
I can't believe I risked Patty's life because I didn't have time. You must think I'm the worst owner in the world.
You didn't know.
You're not mad at me? I am.
You brought her in on time. If you pulled that again, then I might be upset.
It's not happening again, that's for sure. No lilies anywhere near Patty if I can help it. Thanks, Doctor, for saving her life.
It may come as a surprise to some, but cats experience a toxic reaction when exposed to flowers of the Lilium genus. Much like antifreeze poisoning, kidney failure could result. To make matters worse, cats may not show how sick they are at first. If they become unable to produce urine, the prognosis is grave. If cats receive treatment promptly with aggressive fluid therapy, however, recovery won't be far off. The verdict is in. You made the appropriate diagnosis. You never sidestepped the important questions. You clearly know how to treat an animal.
Your brilliance shines clear.
She looks a wee nauseous. Oh no, is she scared? She might not be getting enough water. Feels like something's in there.
Your love for animals shows in how you treat my Athena.
She's running hot. There is something there. She'll feel a little better soon. Just in case. Gotta try everything before we resort to surgery.
I've felt that she's trying to tell me something. Oh, is that not what you asked? I look forward to seeing my rabbits reunited. She hasn't been eating in a way that makes her happy, so she has seemed more aloof. I do think she's angry with me. She looks beautiful. Pineapple juice. What a healthy and natural solution.
So you think she's not mad at you anymore?
I'm sure she isn't. I'm sending out that check today.
If you say so.
Rabbits, like cats, tend to swallow hair while grooming. Unlike cats, however, rabbits are unable to vomit the hairballs to expel them from their systems. That means we must employ other methods to save them from the serious consequences of a lodged hairball. Prevention in the form of pineapple juice or a supply of hay allows the forming hairballs to pass through the rabbit before they can cause any damage. If Athena doesn't get better, we may want to send her into surgery. Thank you for identifying the proper diagnosis. Your investigation of this case was admirable. Due to your treatment, this animal will recover in no time.
I left my son playing with Jonah here, and I came back, and boy, did I have another problem on my hands.
How long has he been moaning like this?
Ever since I came back, he can hardly keep his head up. I could really use some help here. I don't know how to handle this alone.
You're not alone with the doctor here. We'll give Jonah our all.
Nothing like having a new cat in the house. I haven't touched him, except to put him in the car. Something nasty's going on in his mouth. He's been moaning like that ever since I first saw something wrong with his mouth.
Yeah, that's gotta be it. Something's going on here. Mask goes on without saying. Based on what we know, I'm sure this is no surprise. Could be bad. His breathing's not improving. Still warm to me. I believe it. Curious pattern.
Funny how cats can start out so small.
We give them all at once so he can feel better all at once. These fluids will alleviate the shock. No pun intended.
I only got 2 eyes. How am I supposed to prevent this from happening again?
Think inside the box. You give Jonah something to play with, like a box or string. He might pass up the electric cord next time.
Huh, you guys got it all figured out. Thanks, again.
Cats love to chew on anything that looks like string, and an electric cord certainly fits that bill. The burn an electric cord leaves behind often means a severe wound with scarring. As with any exposure to electricity, the heart could also be severely harmed. Jonah responded well to the treatment, but he probably won't eat on his own for a few days while the burn heals. You diagnosed this patient accurately. You really know the right questions to ask. I'm impressed. You used the right tools for the job.
I just have one question. Okay, why did my cat's eyes change color? Well, that's because, well, I'm not sure. I have another question. She's not eating. I'll just ignore that that's not a question. You have me at a disadvantage, sir, but I'm sure the doctor will figure it all out for us. If it helps, Hugs, do whatever you want. Her eyes turned green. She likes to wander off, but she usually comes back okay. No, I have a question. What is abnormal? That yellow tinge explains change in eye color. To me, anyway. Yellow. Yeah, it's not her color. Whatever you're doing, keep it up. I bet you're smart, too. A little low. All those numbers mean something. The source of the yellow. Surgery is officially an option. I don't know what you're doing, but it looks pretty good. It is what it is. I have a question. Do you think Hugs likes me? Okay, so it's not cancer. So she won't be moving around. Can't jump right in yet. Almost there. And here we are. Keep it flowing. These vitamins will get her back on track. I have another question. Here we go. Who do I thank for helping Hugs? I'm going to pass that one right on to you, Doctor. I hope you don't mind.
Surprisingly enough, Hugs suffered more from having a lot of fat on her bones than from not having enough to eat. The feline liver has a lot of trouble processing all that fat, and, as in this case, fails. A feeding tube can fill in the gap until she fully recovers. That was a highly professional diagnosis. You probed the details of this case quite well. Your excellent treatment of this animal means a speedy recovery.
I probably should take him to the groomers, but you guys deal with hair too, right?
If there's a medical problem.
It's nothing serious. He's been losing hair. If you don't deal with that, I should leave.
Hold on. Are you the vet in here?
No, but I am a doctor.
When you've treated as many guinea pigs as the doctor has, then you can give an opinion. Until then, let's see what this doctor has to say.
If my pets keep getting sick, I may have to become a vet.
Here's the problem. Now, what's causing it? I think his fur loss is just the icing on the cake. With those results, I'm surprised he's not attacking us. Exactly what you expected, right, Doctor? This is a start. Next comes the real work.
The missing patches of fur started appearing recently. I did do a once-over, and he felt a little swollen in the abdominal area, but he'd just eaten. No. Well, maybe. He has seemed a bit vicious lately.
It's nice letting other people be in charge.
I don't know what I was thinking, acting like I knew better than you. I forgot how fabulous you are with all my animals. Thanks, Doc.
Cody's fur loss actually heralded a more serious condition called adrenal gland disorder. The diseased adrenal gland grew too large and could have affected Cody's behavior as well as his fur. Once surgery removes the diseased gland, hormone levels will return to normal in Cody, and so will his hair. You reached the right conclusion. Your questions were thorough and relevant. Good. You did a superb job in your treatment. Everyone is so impressed with how well you've been doing that the vet techs wanted to get together to give you the special award straight from them. They love how well you treat the animals and feel privileged to work beside you. I would love to grant you the first annual Veterinary Technicians Award.